LeeAnn, good morning. How are you?
I'm good.
Wonderful. How do you feel? Yesterday we did your m.o.i.s.t therapy for the dry eyes.
Much better.
Yes.
Lubricated, feel so much more refreshed. It's so relieved to feel that dry eye going. I don't have that reflex tearing where it watered up a lot whenever the wind hit it or something. It just, that was amazing. So.
Wonderful. And today's day one when we did the m.o.i.s.t therapy. How would you rate your outcome on a scale of 1 to 10?
Absolute 10.
Super.
Yeah.
Excellent.
Absolutely.
And you can even see for doctors, we did the m.o.i.s.t therapy, including the meibomian gland recanalization. You can see the excess bad oil coming out of each of her glands that we removed yesterday, right? And also helped her with the plugs and improved the tears. And now she's ready for another complex surgery that we're going to do, which is the main reason she flew in here from Texas, which is her radial keratotomy with scarring, very high regular astigmatism, ectasia, and cataracts in the eye. Right?
Yes,
LeeAnn?
very much.
Excited?
Very stable, unstable on the vision. It's like, it's hard to believe that I can actually improve this. You can actually improve this. I've never got any doctors that said they could do this.
Well, we will surely do our best. You
Yes.
can. Right, LeeAnn?
I'm very confident.
Pleasure. Get some rest today. Back to the hotel. I'll see you in
Okay.
surgery, all right?
Awesome.
Lovely.
Thank you. Take
Wonderful.
care. All right.
The scar here. And then the artery cuts. Tubes. And then the cataract. Lovely. So here we are. We just finished up with the case here. Patient with extremely high regular astigmatism with RK cuts done twice here. You can see the cuts with tubes dystrophy with an anterior corneal scar, which is not so visible here right now because of the intense microscope light. And we have performed a dense cataract removal with a perfect lenses, well-centered premium toric lens. You can see the marks of the lens exactly along the marks in the cornea. And very high astigmatism, so we want to make sure we are perfect. And now I will hydrate the incision and then we'll go after the scar. Alright? Comfortable, LeeAnn? LeeAnn, are you comfortable?
Yes.
Lovely. Any pain at all? Super. And LeeAnn is a wonderful, wonderful patient from Texas. And again, as all our patients, there is no IV sedation, there is no anesthesia besides numbing drugs. Sit down to your feet a little bit. Yeah, and I couldn't be happier. I did 4 surgeries in one. Couldn't be happier. Everything going beautiful. You okay?
Yep.
Please thank everybody who prayed for you. And obviously someone is doing this.
I prayed a lot.
I love it. So in this RK area, you saw me remove the dense anterior scar, which you cannot see that, cannot appreciate because of the very intense light I have put on the microscope. And she also has tubes in the back. She has very high regular astigmatism. We have done a toric lens surgery right now, and the incision is holding by hydration. I can put all this pressure, and she's still holding very well. LeeAnn, any discomfort at all?
Yeah.
We're all done with your surgery. Safe travel back to Texas. How was your experience here? LeeAnn? And for doctors who are watching, there is no drugs, no IV anesthesia, no sedation. She's with drops. Right, LeeAnn?
Right.
My pleasure. Antibiotics, please. LeeAnn, we just finished the surgery. How do you feel?
I feel great.
Yes?
Yes.
Any pain, any discomfort?
No.
For doctors who are watching, you saw how complex the case became. Again, I teach all this complex because of my desire, how much I wanted for her. She had RK surgery with very high regular astigmatism, posterior corneal fuse disease, her pupil, her cataract being unique and dense, and in addition, she had a central corneal scar. And what we did is we performed our surgery, placed our premium toric lens very finicky on axis, did not take a stitch despite her RK radial keratotomy cuts, and also removed the corneal scar without any viscoelastics, keeping the incisions hydrated. So no stitch, and you can see her with no drugs, no IV sedation, just drops for numbing. LeeAnn, was it comfortable despite your complex surgery?
Yes. Very pleased.
How was the experience here?
I came in apprehensively. I was doing, oh my God. But I'm very thrilled. I'm glad it's over. I'm getting,
Back to the hotel.
Yes.
Safe trip back to Texas. LeeAnn, been a pleasure.
Thank
Absolute
you.
pleasure. Cheers, LeeAnn from Texas.
Oh, look,
How do you feel?
look sexy.
Looks better with the patch.
Oh, thanks.
How was your experience? Yeah.
It was great. I was very, very relaxed,
Yes.
and you talked me through it, and it was a wonderful experience.
And doctors, she's talking about wonderful experience. She has no IV sedation, no anesthesia besides numbing. She's not coming out on a stretcher, and you saw the surgery, how complex she is with radial keratotomy cuts and the scar and the cataract and everything that we've done, and there is no stitch.
No.
And here she is.
You met the challenge and you did wonderful. Thank you so much.
An honor. My pleasure. Safe travel back to Texas. Come this way, please, LeeAnn. All right, LeeAnn, we're all done. How do you feel?
Good.
Yes? How was the experience?
Wonderful.
Super, super. So despite your complex eye, which we showed doctors today, extreme radial keratotomy with the scars, with the cataract, no stitch, ready to leave for Texas. You feeling okay though?
Yep.
Yes, because as you can even see for doctors, extremely hyperopic lens, even though it's a thin profile optics and high astigmatism. So LeeAnn, being a pleasure.
Thank you.
Really a pleasure.
All right, and we'll see you tomorrow.
Morning, how are you, LeeAnn?
Good.
Excellent. How do you feel?
I feel really good.
Excellent. I already see the vision has improved.
Mm-hmm.
Yes, can you tell the difference?
Yes, I can. So I feel
How was your experience yesterday?
there was no pain. It was very successful. I felt, and I felt like you were very accurate in what you're doing, and you're talking to me all the way. It made me feel confident. So it was just all nice. So it was no pain.
My pleasure, LeeAnn. Again, for doctors who are watching, I do this impromptu, LeeAnn, to constantly inspire my colleagues. LeeAnn's case, she has come from Texas. LeeAnn, you can quickly go over your case, quick.
Mm-hmm.
What's your case, LeeAnn? What did you come with? From where? What's going on?
Would I come from Texas?
Yeah, like,
come-
just describe your case quickly, 30 seconds.
I came from Texas. My eyes were very distorted for the RK. I couldn't see hardly anything. It was just very scars extracted to me, and it was just something that I really wanted to get done to fix my eyes. I'm real worried about the future, so I just came here to get things done. And I knew that I felt confident with Dr. Gulani. I heard read about him all through on his website, and realized this is the place I need to be. I had one shot at it, and I took it, and I'm here now, and I'm very pleased.
My pleasure, LeeAnn. For doctors who are watching, you can see the central scar. Even though she had just 8 cuts, very high regular astigmatism, you can see the scar in the center right here. And through that, we have done her surgery, LenZoplastique, and removed the cataract, and there is no stitch. And this is day 1. You can see no stitch. You can see the premium toric platform lens in place, perfect on axis. You can see her RK cuts, incisions right here, hydrated, no stitch. And here she is with the scar completely cleared out, all done at one shot. And all this surgery was done, LeeAnn, without anesthesia,
Right.
without any sedation, just with numbing drops. So in our suite, in my surgery suite, so any pain, any discomfort during, after?
Nothing at all.
Lovely. And you ready to fly back today, LeeAnn?
What, tomorrow? Yeah, tomorrow I go back. So yes, I'm
Honor.
excited.
Absolute pleasure. Absolute pleasure. Anything amazing, LeeAnn, here?
No, I think it's worth the money to get her eyes fixed. Every penny.
Been a pleasure. Yeah.
Thank you.
Take care of the eyes, please. Safe flight. Okay?
I will.
I'll see you guys. LeeAnn, how are you?
Good. I'm
Back,
here for my second eye. I'm excited.
back from Texas.
Back from Texas.
Lovely. Come on, let's
Okay.
get ready.
Okay.
Super. Yeah, you okay? Doing fantastic. What's that? Yes, with the line moving. That's good. 28.5. Yes, yes. polish. Wonderful. For doctors watching, here's my really another wonderful patient of the day. She's coming back from Texas for her second eye. We did her first eye before this, and here you can see the arcade cuts on top and very high regular astigmatism. Sometimes the cuts don't correlate to astigmatism. Even 30 cut arcade sometimes can have little astigmatism, while twice done 8 cut like this can have much more high regular astigmatism. I'm getting finicky, correcting the optics with my two-hand toric technique. Again, being right on the axis, we can see here. I'm in our eye now. You can see the axis on the cornea here. Right here, matching the axis on the lens. And as usual, patient has no anesthesia. LeeAnn, you comfortable?
Yes.
Any discomfort, anything at all?
No.
How was your experience?
Painless, wonderful.
Super, super. Safe travels back. I'll see you before you leave.
Yeah.
Congratulations. Super. Here we go. Ready? You okay, LeeAnn?
Mm-hmm.
Doing beautiful. I'm done. You're all done, LeeAnn, with your second eye. How do you feel?
Great. It felt wonderful. I think I was falling asleep on that.
Again, LeeAnn, for doctors who are watching, this is my amazing patient among all my really amazing patients all day. She's from Texas. She's had this is her second eye, right? You've flown back for.
Right.
And as you saw, very complex, not only the cuts, very fragile cuts, very high regular astigmatism. We did a premium cataract, put in our lens and also aligned it. And you saw me again, as usual, no stitches despite the RK cuts. She has no IV sedation, no anesthesia, just numbing drops. How was your comfort?
It was great.
And then during surgery, you also saw me lift off her scar and help her that way too. So she'll heal over time. And LeeAnn, absolute pleasure.
Thank you so much.
Safe travels back.
Thank you.
Absolutely. All right, here we are, all done.
All done.
Congrats!
Yes. I can see.
Whoop whoop.
Woohoo.
Wonderful. Second eye done.
Yes. Second eye surgery, and it was just as great as the first time. I was falling asleep. Actually, it was just. I was so relaxed. So it was a great experience. I would recommend this to anybody who wants to see better, and I never thought I could ever see without contacts or glasses, and it's truly a miracle. Thank God they made you with the clone you.
A pleasure, yeah. Safe travel back to Texas. Doctors, you already saw her complex case with radial keratotomy, cuts, irregular astigmatism, cataract. We didn't take stitches. She has no anesthesia. She's walking out. And we also removed her scar while we were there, right?
Yep.
And no stitches, so please be careful on your flight back.
I had my cataract surgery through radial keratotomy, and I'm flying out tomorrow, and I see perfectly. And I'm very excited. Actually, I had both eyes done. My second eye was just done today. The other one was done about a month ago.
Second eye we just did a
Yeah,
minute ago.
Just a minute ago. And no pain. Just fabulous. Yay!
Yeah.
Thank you so much.
Safe travels. Careful,
You
okay?
too.
Careful.
Thank